Healthcare is one example of an industry that has been severely damaged by government involvement. And the story of this goes all the way back to during the Second World War, when the government was trying to deal with significant wage inflation that was a result of spinning up the war machine. Wars are oftentimes and pretty much always accompanied by massive increases in government spending, which requires the creation of lots of debt, the creation of lots of money to pay for things, and we needed a lot of workers in the factory. So wages were going up very quickly. So in an effort to halt the wage increases and to keep those under control, the government basically said, you know what we're going to do? We are going to, instead of giving you a raise, we're going to cap our salary increases, but we're going to give you free health care. We're going to give you health care benefits, health care insurance benefits with your job. And in doing so, through favorable tax treatment that basically tied employment to health care coverage, we set the stage for what has been a slow but painful downhill slide ever since. So in that environment, where all of a sudden health care is no longer between a patient and a doctor, but when coverage for health care is tied to an employer, all of a sudden you've got a situation where A, you're much more tied to your employer. And B, with a case of pre-existing conditions, if you have a policy that treats you well over here, that's kind of a disincentive to maybe taking a broader view and look at all of your opportunities as a potentially productive and free individual to make your own decision about how you want to best run your life economically. So the first problem that we did is we tied healthcare to employment, and that was a start of going in the wrong direction. The other big thing we did, which hasn't made matters any better and has certainly made matters worse, is we have this extremely warped idea as to what constitutes insurance in healthcare. And what I mean by that is, you have potentially, if you're a homeowner, you're going to have homeowners insurance, right? Mm-hmm. And if you're a homeowner and you have homeowners insurance, you'd think about, well, gosh, I've got homeowners insurance, and I know that if my house were to burn down, it'd pay for me to get a new house. That's a pretty good deal. Why don't I just have a campfire every weekend with my kids and roast marshmallows on my living room floor? Because I know that I'm insured, and if there's smoke damage, insurance will pay for it. If the house burns down, insurance will pay for it. That doesn't make a whole lot of sense. No one's going to do that, right? Because clearly, if you are willfully negligent and you're having campfires inside your house, the insurance company's not going to pay for the damage that results. So there's a built-in disincentive to doing things that are objectively going to hurt your house when you have homeowners insurance. How much do you think it would cost to buy homeowners insurance that would build you a new house if you wanted to have campfires inside? I don't think I could afford that kind of insurance. I don't think anybody could afford that kind of insurance. But that's exactly what we expect our health care insurance to do. It's not really insurance at all. It's really more like prepaid health care, because we want our insurance to cover everything with a $15 copay. All the medications, covered. Any surgery you need, $15. I mean, you get the idea. So the idea that insurance can cover everything is basically saying, you know what, Mr. and Mrs. John Q, Jane Q public, it really doesn't matter what you do. It doesn't matter if you're healthy, if you're unhealthy, if you eat McDonald's once a year or 4 times a week. Not to say that McDonald's is necessarily always bad, everything in moderation, right? But we've got to use common sense. And if someone's going to smoke a pack a day and do things that we know objectively cause you to have elevated health care expenses over time, the system right now doesn't really take that into account, because the individual is extremely isolated from the consequences of their actions. And there's no real incentive to maintain and to enhance your wellness. So that's one of the other big challenges we've got, is getting people to understand that ideally healthcare needs to be and should be between a patient and a provider. It might be a doctor, it might be a chiropractor, it might be an alternative medicine practitioner. There are tons of flavors of medicine, not all of which are, well, any of which may be the best for any particular patient in any particular situation. And that's the essence of what a free market of medicine would provide, is the ability for providers to compete as providers, not as corporate institutions, not as PPOs, not as American Hospital Association, but as individual providers in offering patients the best value for their healthcare dollar. And again, giving the patients the incentive to say, you know what, I know that my routine health care, it's going to cost me something. So yes, we should absolutely have tax-free savings accounts for health care. We should absolutely not have flex accounts tied to an employer where if you don't use the money by the end of the year, you'll lose it back to the company. That doesn't make a whole lot of sense at all, really. And frankly, we should have lots of tax-free savings. All of our savings should be tax-free, but that's another story. But specifically for healthcare, the idea that we're giving individuals access to these accounts with all of these crazy rules and reporting requirements and do this and don't do that and putting the IRS right there in the doctor-patient relationship, it just doesn't make any sense.